put a top back. 06 top down, 4-4's black now. I'ma do me, let the critics go and talk now. Right, and even
Because Journey followers, I've been meaning to get this video to you guys for the longest, but you know, things got in the way, like health issues and everything like that. But I'm finally here and I am ready to make another video. The name of this video is Things That Annoy Patients. Patients as in like me and you in the medical field. Just some things that really truly annoy us. So the first one I'm going to say is paperwork. Now if you're going to a new doctor's office and everything like that, you do have to fill out paperwork. However, we're in the day in 2017 that stuff should either be emailed to me or online. And it's usually that way. However, there are a select few. It's not that way. And you ask them, they're like, oh, we haven't gotten that high tech yet. We haven't gotten there yet. What? You haven't gotten high tech? It's an email with an attachment. That is not high tech. So yeah, that's annoying. That's really annoying because if you have to fill it out all when you get there, that could take up like 15 to 30 minutes of your appointment time. So yeah, that's one of the huge things for us. The next thing is the waiting room, which kind of has to do with that. If I scheduled an appointment at 2, I arrive at 1:30, 1:40, and then it's 4 o'clock p.m. and I'm still waiting, that is not okay at all. That is really not okay. You need, or the doctor needs to check his office staff to make sure that does not happen. But it's actually pretty commonplace. That's not okay. That's not fair to me. Because when I go in the doctor, if they call me back at 4, I don't want to just have a 10-minute review. No, I need all of your attention to explain to you how to treat me. So that's another huge one that it can really be fixed by the office staff being like trained again. So the next one is a lecture. And a lecture, like, I'm just going to use this for an example. Let's say I'm a smoker or I'm overweight and I've been like that way. I'm 45 years old. I've been that way. However, I fell off the stairs and broke my arm. So I'm here to talk to you about my arm. However, when I get in there, you lecture me about smoking and being overweight. Do you not think that person has heard that all of their life? They know they shouldn't smoke, and they know that they need to lose weight. That's not the time or place. They're there because their arm is broken. So let's talk about that. I'm just saying, like, if you made it that far in life, you know smoking is horrible, and that you shouldn't do it. It's just not okay. Like, stop. But if I'm here because I have a broken arm, we're gonna stick to that subject, okay? So another one is looking frazzled. So if the doctor comes in, he's like, then I'm getting, it's not okay. Like if I've done some blood work and done some tests, and here you're going to give me the results, and you're coming in like that, you just set the whole atmosphere is changed because you came in like that, and I'm scared of what could be happening to me. Yeah. The next one's going to be that you don't explain. And I think that's a big one. Just not explaining. Like, let's say, I'm going to use this for an example. Let's say I had just been diagnosed with MS. And I'm coming into your office and you are prescribing me beta-seron, right? And you send me home, you tell me the package should arrive at XYZ. I get the package of these needles and little tubes. I don't know what I'm doing. You haven't set me up with the MS nurse. You haven't told me that this medication is injectable. And you haven't given me anything. That's not okay. Let's say that I was a new patient, and I had nothing ever. I've never even heard of that MS. That I'm just gonna get home and know what to do. That person is going to get on YouTube. That person is going to do the research for themselves. And that's really not okay because they don't deserve that. They deserve for you to explain the medicine, why you're giving that medicine. Tell us how the medicine works. And if you're just diagnosed, you don't even know to ask those questions. I think that's you just think the doctor must just think that we know everything that they know. And no, we don't as far as for that. So, yes. Please explain. Another issue is to tell us There's nothing wrong. It's all in our head. Really? You know, my whole, you know what, I'm going to leave it alone. Because there's nothing wrong that I was told, and here I am having MS for the 13th year. So yeah, let's just move right along. Oh my goodness, this one has to be everyone's issue. Let me do an example. Ring, ring, ring. You have reached the office of Dr. Johnson. If this is an emergency, please hang up and dial 911. Are you kidding me? I think we all know that. Just please hang if it's an emergency. I wouldn't waste my time calling you. No, it's not. Like every single doctor's office is doing that, and I cannot stand it. Really? Is this an emergency? Please hang up and dial 911. You don't think I know this? Oh, that literally has to be everybody's issue with that one. So the last one I'm going to talk about is ID and insurance card. Of course, when you go to the doctor, they're going to need that proof of ID and that you have insurance. Okay, so let's say I turn that in. The next doctor's office, they're asking me for it again. So I'm like, I just gave it to you last time. Yeah, we're going to need it every time. Why? I mean, I'm sure there's a reason, but I just don't know it. All I know is that it's quite annoying going into my purse, getting those items out, giving them to you, and then you giving them back to me every visit. So, yeah, those are just a couple things. I'm sure there's a lot more. You guys, please leave other things, other examples in the comment section, and I will see you again soon, maybe today if I feel like doing another video. Thanks, guys. Bye.